Good afternoon. Thanks for joining me again today. My name is Laura Scott. I'm a doctor of physical therapy and pelvic health specialist with Cornerstone Physical Therapy. And I'm delighted to be sharing with you today one of my favorite topics and one of my favorite things to treat, working with patients to improve their comfort with bowel movements. So today we're talking about constipation and physical therapy management of constipation. Cornerstone Physical Therapy is a locally owned and operated, family-owned and physical therapist-owned and practiced physical therapy clinic here in the Asheville area since 2008. We have 3 locations in the Asheville area to serve you. And as a clinic of specialists, we offer specialty treatment not only in various orthopedic conditions, about which many of you are familiar with physical therapy in the context of, say, knee pain, but then, of course, we offer pelvic health as a specialty area, facial and jaw pain, CrossFit athletes and weightlifting, lymphedema or swelling management, and massage therapy. At any point in the process of this presentation, if you have any questions or comments, feel free to drop them in the comments section below. Elise, our marketing director, will be monitoring them and will open up for questions at the end of the presentation. And if you're watching this video later on when we aren't live anymore, you can still drop a comment. Elise will get back to you. And if you're interested in scheduling appointments, one of our new patient coordinators will get in touch. Okay, folks, so we're talking today about constipation. This is generally understood to be difficulty with bowel movements, this uncomfortable condition that can be either a side effect of a primary medical condition, a result of a change in lifestyle. So lots of different reasons at any point along the course of our lifespan that we may become constipated. Also today, I want to specify that I'm particularly talking about constipation for the adult population. Pediatric constipation is a separate topic with more of a specialty focus, and that's something that we can also give you some information on. But today we're talking about constipation in the adult. Constipation is the most common GI or gastrointestinal complaint. This affects somewhere in the neighborhood of 4 million Americans each year. This accounts for 2.5 million doctor's visits every year. And we're looking at something to the tune of over $700 million, $725 million are spent by Americans on laxatives every year. So constipation has an effect on the healthcare system. This is your hard-earned money that you're spending on laxatives instead, and often people are still not getting the relief that they need. Most commonly, constipation affects adults, most commonly 65 years of age and over, and more commonly women than men. But that is certainly a generalization. We see this along the lifespan in the adult population, as someone may become constipated as a result of temporary hormonal changes, maybe with respect to pregnancy or the postpartum period. And then certainly changes of life, perhaps around menopause. We might see this occurring as a result of a surgery. So this might be a temporary period in someone's life. So let's say after you have a back surgery and you're taking some heavy pain meds. But if difficulty with bowel movements persists, then we're looking at a clinical definition of chronic constipation, and this is something that you have power over. So we'll continue. So what are the expectations for normal bowel movement? In a typically functioning system, we're looking to achieve 1 to 3 bowel movements a day, or at least 3 bowel movements per week. The stool itself should be formed but soft and easily passed. We shouldn't have to experience strain. We should certainly not experience pain with bowel movements. So we'll keep this in mind. Our goal is to see 1 to 3 BMs per day, or at least 3 per week. And what the stool looks like makes a difference, of course, in its ability to exit our body, but it also gives us information about your digestion. So bowel movements are important to a healthy system. Evacuation of your bowels, elimination of waste products from the body is essential to having normal chemical, hormone function in the adult body. So again, the definition of who's constipated is someone who's having fewer than 3 bowel movements per week. And I mean bowel movements without Dulcolax, Miralax, etc. So we're talking about natural bowel movements per week. In the condition of constipation, stool will be hard and dry. It's probably going to involve some strain, some difficulty on the toilet. It's often associated with a feeling that you are blocked, or maybe you can achieve some bowel movement, but it doesn't feel like you're ever finished. But there's still something in there, it's just not making its way out of your body. In order to be considered chronic, you should be seeing this condition. This is going to go on for more than 12 weeks. So if you're temporarily constipated as a result of a surgery or another medical procedure, or you're temporarily constipated as a result of your pregnancy, for example, this should resolve. But if it doesn't, now you know who to call. Okay, moving on. So it's essential when we talk about constipation, which refers to evacuation of your bowels, a bowel movement. That's part of the digestive system. So we want to understand what's going on with normal digestion so that we can see where along the process that if we have an interruption in our normal flow, where we might end up with a constipated condition. The first step in digestion is chewing. So when you have lunch, the movement of the teeth and jaw, the movement of the facial muscles moving down the upper GI tract stimulates the movement of the intestines. The intestines move in a smooth form like this. This is called peristalsis. That means smooth muscle movement to push that food mass along the system. Okay, so we had lunch, we chewed, we swallowed. That mushy mass is now in the stomach. In the stomach, we're dropping enzymes, acids to continue to break down that mass. That mass is now more liquid. We call it a bolus, okay? That liquid bolus is now ready to go into the small intestine. From the stomach, that liquid bolus drops into the small intestine. And it's going to meander and make its way around the small intestine while our body is going to be extracting all the nutrition from that food, all the other parts that we need to have a normally functioning system. Vitamins, minerals, amino acids, those peptides, all the stuff that our body needs to keep going. But that bolus remains liquid. So that liquid goes all the way through the small intestine. When it's finished its journey, now the next step is for that liquid bolus is to go into the colon, which now starts what we think of as the bowels. Okay, so as that bolus moves up and around the colon's job in life is simply to dehydrate that liquid mass. So the colon is taking the water and to some extent some of the electrolytes, okay, out of that liquid bolus. And that's where stool is forming. By the time that bolus, or your lunch, makes its way down to the rectum to be ready to be eliminated, we should have what's called a formed stool. If stool is too liquid, we didn't have appropriate digestion, it's going to come out in the form of diarrhea. It's too loose. It didn't spend enough time in there in order to be dehydrated by the colon. If that stool is too hard, dry, cracked, think like beef jerky, right? It spent too much time in the colon, became quite dehydrated. That means that our system, or our transit time, was too slow. Too much water gets pulled out. It's too hard and dry by the time it comes down into the rectum, and you're going to have a time eliminating that bowel movement. So what things look like in the commode when you're finished tells us a lot about where we are with our digestive system. We have to have adequate transit time to have the right balance for a good bowel movement. All right, everyone's favorite diagram, the Bristol stool scale. This describes, in a professional way, what's your poo telling you. We go from a type 1 to a type 7. Type 1, hard, dry pellets. Going to be maybe more formed, but hard, dry, and cracked. We move all the way down in a graded system down to type 7, which is entirely liquid. Those folks are experiencing diarrhea. That stool is moving too fast through the system. The harder stuff, type 1, type 2, maybe a type 3, the top of that scale are what we associate with constipation. We have to find the happy medium, and we're looking for a type 3 or a type 4 stool to have the most effective and comfortable normal evacuation. So type 3, type 4, we're getting that sausage or that snake type of appearance, about 12 inches in length. It's soft enough to move out, but formed enough that you have one bowel movement. More than most of you wanted to know today. Okay, maybe it's not your fault. It's not because you're not eating your fiber. Lots of medical conditions can yield constipation as a side effect. Some of these conditions are going to be temporary and some are not. Even for those with a side effect of constipation as a result of a neurologic or an endocrine or a systemic condition, that won't go away. We can still make an improvement in your bowel regularity with some training. Neurologic conditions may deplete or interrupt or interfere with the nerve signals that go into the digestive tract, those intestines and colon, that tells your body to digest, right? Of course, in the case of MS, Parkinson's disease, etc. The metabolic conditions, the endocrine conditions, I'm throwing in there as well, so some of the hormone conditions, maybe diabetes, hypothyroid, and then maybe some of the temporary conditions that might be effective at some point in the month during a menstrual cycle, changes around menopause or pregnancy, for example. The hormone interaction can change our digestive time. And then, of course, some of the more systemic conditions, lupus, etc., celiac. So any of these types of conditions can have an effect on your digestion. Then we have the conditions of the intestines or the colorectal system itself that can affect transit time. When we talk about slow transit, we're not moving, traffic is stalled. Maybe there's a physical obstruction. Okay? Maybe there's a change in the shape of the intestine itself. Something like a polyp or a diverticuli or a hemorrhoid, internal hemorrhoid at some point along the system, that will create a roadblock or an interruption in that traffic. The presence of scar tissue, adhesions, the result of another surgery or some scarring on the intestine itself can, of course, affect our traffic time. Certainly tumor, certainly cancer, and then the always famous irritable bowel syndrome will affect that transit time. Any of these medical conditions have a possible side effect of constipation. In the absence of any of those, in an otherwise healthy system or an otherwise healthy colon, there are still some factors in our life that will create constipation. Factors pertaining to diet, factors pertaining to stress levels, change in your physical activity level. Constipation is associated with a more sedentary condition, sedentary work, sedentary lifestyle, or maybe medications. We might have a side effect of a necessary medication. Also, the presence of multiple medications can result in changes in your bowel habits. Some of these factors are where we can have an impact in making some habit changes that can really improve your comfort with bowel movement. So we've talked about what's going on in the upper part of the body, in the system, in the brain, with the habits that may be changing in our body to create difficulty with bowel movement. So that's more what's going on above, but then that stool has to get out. The second approach to looking at constipation is what we call outlet dysfunction. That bowel movement can't happen because of what's going on below, more of a rectal or an anorectal condition. We have to make it through the system. We have to have good transit time, but if there's a roadblock, we're not going to have an effective bowel movement. Some of the terms we see associated with outlet dysfunction include this concept of incomplete defecation. We couldn't finish. We see the term pelvic floor dyssynergia. There's a coordination problem. The pelvic floor or the anorectal muscles don't relax enough in order to make this bowel movement happen. So we're not coordinated, and this is where we encounter strain. I think I'm pushing. I feel like I'm bearing down and pushing from the top, but the muscles from below are saying no exit. So above and below need to work in harmony to have effective bowel movements. As you can see in some of these outlines, the outlet concept refers to the muscles at the bottom of the body. I'm going to bring in my handy pelvic floor model. Everything that you see here that is red refers to a muscle. So you can appreciate how around the anal opening, these muscles that do not relax enough are going to create an obstruction or an outlet problem. Stool may be ready to go, but we're not relaxing enough when we're on the toilet. We think that we're straining, but what's happening is that we're squeezing even tighter. So this is the approach to muscle training, pelvic floor relaxation, when we have more of an outlet problem with bowel movement. Constipation is uncomfortable. Constipation is expensive. And if that weren't enough, we have some ugly side effects that no one enjoys about not being able to release these waste products from the body. Bloating, abdominal pain, gas, decreased appetite, headache, bad breath, depression. Did you know that a percentage of the serotonin, which we need for mood, is produced by the bowel? It's produced in the colon. So if we're not having effective emptying, we're not getting good serotonin production for our mood. rash. We can see skin eruptions, for example, in the case of like a celiac disease. And then, of course, with all this straining, we have hemorrhoids. We're producing maybe a hernia, maybe a prolapse of some of the pelvic organs. The strain is not healthy for the pelvic organs. And you may even experience urinary incontinence if the load in the rectum is such that there's pressure. There's not enough room inside the pelvis. So then you sneeze and your bladder leaks because there's just not enough room. We have an overflow problem. So constipation needs to be addressed. An effective way to address constipation is through physical therapy management. So I'll just spend a few moments talking about how I, as a physical therapist, and my colleagues as pelvic health specialists, approach the digestion, the transit, and the outlet aspect to constipation management. Physical therapy is effective for constipation. Working with a physical therapist with a 60-minute session, you have the opportunity to address the individual components to your digestion and to your bowel movement. Each person's medical history is important to understand because constipation has an individual kaleidoscope of background going on in that body. So as a pelvic health specialist, we have one-on-one sessions, and we see this effectively treated in as few as 3 visits for some basic education, maybe 12 or maybe a little longer, depending on the origin, how this all came to be. Physical therapy is an ideal setting to work towards the right habits, habit training. And then we have the muscle training aspect. Now, my constipation folks, we are not practicing the Kegel or the pelvic floor muscle contraction. We're learning how to relax and coordinate the pressure system so that our pelvic floor can relax in order to effectively evacuate. Back to the things that we can control voluntarily and with changes in our own habits that are well addressed in the physical therapy environment. Diet. Not just fiber. What kind of fiber? So assessing the diet, identifying foods that may be an irritant to the bowel, where that may be contributing to what's going on with our digestion. That's an important part of what we can do in physical therapy. Addressing stress management techniques. For people that experience constipation, stress and anxiety results in a slowing down of the digestion. Incorporating physical activity, incorporating relaxation techniques is how we start to address that. Physical activity, obviously. Sedentary or reduced amount of motion will decrease the amount of muscle stimulation towards the digestion. So, of course, as a physical therapist, we're addressing what kind of movements and what kind of exercise can stimulate healthy digestion. The physical therapist will not make recommendations as to your medication management. That's a job for your primary provider, but we can also provide some insight as to how some of these medications or how some of these medical conditions are coming together to give you the picture, to give you more power to be able to modify or make some change. Constipation is managed by a physical therapist with a program that we call Bowel Rehabilitation. So the plan is to optimize, to begin to stimulate, to get that good motion through the intestine. We need that peristalsis to be happening to move that stool. We've got to have good stool form. We want to achieve the best digestion that we can. And we need opening up. We need to be able to complete the bowel movement, emptying without straining. So that's my plan, with the goal, the intention again, to be 1 to 3 bowel movements a day, at least 3 bowel movements a week with an optimal stool form. We take a three-pronged approach. In the education or the habit training, we'll evaluate diet. We can evaluate and educate what are the types of foods and maybe even drinks that may irritate the bowel such that you're having this reaction of slow transit. Not all fiber is created equally. The right balance of soluble fiber and insoluble fiber can have an effect on how quickly that food is going to move through your system. The bowels love routine. When we get out of our routine, we may have short-term constipation, let's say if we're traveling, right? So assessing and developing that routine to put your bowel in the right energy, in the right place, is very helpful for my folks in trying to stimulate more bowel movement. We may use something called a bowel diary to look at the habits and look at the change over time. Body mechanics, how we use our body, muscle training will be very effective in teaching that outlet. There's a lot of interesting therapeutic exercise that we can use to stimulate your digestion. We're looking at respiratory training, how we breathe in order to create pressure without straining. How you sit on the toilet matters in order to give your body the easiest way to open up and to evacuate. We call all of these things defecation mechanics. Combined with pelvic floor relaxation, this training process helps you have power over stimulating and accomplishing that bowel movement. And finally, in the category of manual therapy, abdominal massage is a very powerful tool that we have to stimulate digestion. It's very easy for you to take home with you. There may be stretches to help address the tightness of the hips or the pelvis. And in some cases, direct massage of around the pelvic muscles or of the pelvic floor itself to teach the pelvic floor and improve the ability for those muscles to relax. So I hope that helps you understand how working with a physical therapist can be a great choice to giving you the individual attention and training that you need to be able to be more comfortable in the bathroom. Constipation is common, but it's not normal to have fewer than 3 bowel movements a week, and it can affect your daily life. That healthy evacuation is essential for a healthy system. The bathroom can become a stressful place. We don't need that kind of stress in our lives. And you deserve to have support and training that's professional and that's respectful to address bowel movements. You have access to a physical therapist. It's not always necessary to have a referral from a primary physician. That depends on the insurance, but the majority of insurances do not require you to have a referral from a physician first. So you should know that you can call our office, call Cornerstone Physical Therapy directly to set up an evaluation. And if your doctor of physical therapy feels that it's important to have more medical information, that's something that we can get. Physical therapy is a covered benefit by virtually every insurance provider. You have the opportunity with a physical therapist to have an individualized plan of care. Call our office and the new patient coordinator will work to verify what your insurance needs, what your coverage level is, help you figure out your copay, and all of that stuff on the back end that we can do to help get you access to your plan of care and to see your physical therapist. So folks, toilet paper is at a premium in this day and age, But just because toilet paper was hard to come by doesn't mean you need to be conserving your bowel movements, right? You have 3 options today to stop straining, to have a less stressful bathroom experience. You can come into the clinic. We have our one-on-one sessions and private treatment rooms, and we can have our physical therapy care in the traditional fashion, which is face-to-face. We are also offering telehealth. And if it works better for you and your life to have some education and a plan of care that we conduct over telemedicine, that's an option for us as well. And our third option is to use a hybrid. At this time, if you're more comfortable staying at home and having a telehealth plan, and then maybe in a few weeks or a month or so as things change in our community, you're ready to come into the clinic, that's an option for us too. So 3 options today to have a more comfortable bathroom experience. Reach out to us on Facebook, call the number below, shoot us an email, or come into the clinic. We're here for you at 3 different locations to promote pelvic wellness. I'm here for any questions that we may have live in the comments section of our Facebook page. Thank you so much for joining me again today, talking about constipation and physical therapy management. And get in touch if there are any questions that you have. And again, my name is Laura Scott, Pelvic Physical Therapy.